Go ahead now.
Hello, everybody. I'm Dr. Rashmi Niphadkar. I'm a consultant at Oasis Fertility, Pune. Welcome to today's Facebook Live session. And today, our topic of discussion is PCOD and obesity. So, let us start by talking a little bit about PCOD. And we all know that it's a very prevalent disease complex out there in the society today, and a lot of information is there on the net. So, I would be rather talking about PCOD with regards to fertility. Let's start off with discussing a little bit about what exactly is PCOD and how do we diagnose it. So, there are three main things to remember about PCOD. The first symptom that you can pick up at home to diagnose PCOD is if you have irregular menses. So you may have cycle length variation. Sometimes your cycle may come right on date, whereas other times your cycle may be a little late, suppose say 40 days or 45 days cycle. Also, you may bleed less than 8 times in an entire year. So that is anovulatory cycles, right? So PCOD may first symptom that you can pick up is if your cycles are irregular, you can go to your doctor and check if you have PCOD or not. The second thing to remember is you may have signs of hyperandrogenism. So basically, in PCOD, what happens is your testosterone levels may go up, and what it manifests as is increase in your facial hair, thicker, coarser hair. You may have acne on your face. You may have oily skin. You may have increased dandruff. And in very severe cases, you may have hair which are coming on your abdomen, on your chest, on your back. So, male pattern of hair distribution is what you have to pick up. Anytime in your life you may see an onset of hirsutism, as we like to call that. So if you have any sign of hirsutism, also you will go back to your doctor and check if your testosterone levels are high and if you have PCOD. The third thing to diagnose PCOD is by your sonography. So your doctor will recommend a transvaginal sonography or a transabdominal sonography. And on that sonography, if you have multiple eggs lined peripherally in your ovary and a count of maybe around 20 or so, you will say that you have PCOS. So this is a sonography finding. So any two of these three symptoms, if you pick up, if you have irregular cycles, or if you have any signs of hyperandrogenism, that is increase in testosterone levels like hirsutism, etc., or if your sonography tells you that you have PCOS, you may be diagnosed with PCOS. Now, PCOD is a severe form of PCOS. Um, so one of the important thing is before you are labeled as PCOS or PCOD, the thing to remember is that you have to rule out other pathologies that are causing similar symptoms. So you have to do your hormonal profile. You have to rule out if you have any thyroid problems, if you have any prolactin issues. By sonography, you also have to rule out if you have any ovarian tumors causing increase in testosterone, because there may be various pathologies in your body causing a similar profile of symptoms. So before you get labeled as PCOD, make sure that you are ruling out all these other pathologies, and then in the end, you are being diagnosed with PCOD. Another very important diagnostic test to diagnose PCOD is your AMH or anti-Mullerian hormone levels. So, what is AMH? The little eggs in your ovary are going to give off AMH hormone in your bloodstream. So, obviously, more the eggs in your ovary, more will be your AMH levels. So, a cutoff around 4 and above will be diagnostic of PCOD. So, it's a good collaborative measure. Whenever you get diagnosed as PCOD, whether you want your fertility treatment or not, it's always a good idea to get your AMH level tested in sync with it. Right. So now let's talk a little bit about pathophysiology of PCOD. Why does it occur? Right. So there's no known trigger or there's no known standard set of point wherein we will mark कि इसकी वजह से PCOD होता है. But you may have an altered hormonal profile. So your GnRH or the gonadotropin releasing hormone, your FSH or the follicle stimulating hormone, and your LH or the luteinizing hormone, they are given off in from your brain at regular pulses. Now, when this pulse regulator is off, you may have a onset of PCOD. So, whenever we do our entire profile, we do these hormones as well, so that we know whether or not these pulses are coming at a regular period or not, and how in sync your cycle is. Right. So, altered hormonal profile is one pathophysiology of PCOD. The second is insulin resistance, and this is a very, very important factor in your PCOD. You will see an altered insulin resistance in PCOD patients. And the third is hyperandrogenism. So it becomes a sort of a vicious cycle. Your hormonal profile is off, your insulin resistance is off, and your hyperandrogenism is working, and this keeps playing off in a loop. So it's a vicious cycle which we need to break if we have to cure PCOD, or if we want your fertility treatment to go on. So all these three pathophysiologies are important when it comes to PCOD. Now, does PCOD have any long term sequelae on your life? And the answer to that is yes, they will. And how will this manifest? You may be predisposed to developing type 2 diabetes mellitus, because one of the pathophysiology of PCOS is insulin resistance. And what this causes is it predisposes you to developing type 2 diabetes mellitus. So if you have PCOD, you have to be more alert about diagnosing your sugar levels, right? You have to be more proactive in tracking or monitoring your sugar, and knowing this, that you may be predisposed to that. So this is a good awareness perspective, so you can act proactively about it. The second thing that you may have is an altered lipid profile. So do track your cholesterol and your lipid profile as well, because you may be predisposed to hyperlipidemia. The third thing that you may be predisposed to is cardiovascular risk. Okay, you may be more at a risk of myocardial infarctions, more at a risk of stroke, because of your altered lipid profile and altered insulin resistance. These things also come into picture. And the fourth thing that you have to be quite proactive in tracking is if you're predisposed to endometrial hypoplasia. That is, the thickness of your uterine lining may be more in PCOD, because in PCOD you have more of estrogen and more of unopposed estrogen levels. So the progesterone hormone is less because of anovulation. You may have increased thickness of your endometrial lining, and what this predisposes to in your future life is an increase in endometrial hypoplasia and a mild increase in your endometrial cancer risk. So you have to be more proactive about that. You have to track your endometrial thickness more often than not, and try and manage your PCOD so that you have less of these long term sequelae. So now, a common question that we have is, does PCOD equate to obesity? So the answer to that is, not everybody who is obese will have PCOD, and not everybody who has PCOD will be obese, right? Now we do see a good correlation of PCOD and obesity, as in many obese patients are PCOD and many of the PCOD are obese, but not everybody. So let's not assume that if you are obese, you will turn up with PCOD. And let's not assume vice versa as well, that if you have PCOD, that means you are obese. We do see a good chunk of patients who are lean, whose BMI is less, but they still have and are still diagnosed with PCOD, right? So not a direct correlation, but yeah, we do see a lot of cases where there is a good correlation as well. So what about obesity? How does obesity affect your overall health? So we all know that obesity will predispose you to cardiovascular health diseases, hypertriglyceridemia, fatty liver diseases, more of osteoporosis, and all these overall health effects are definitely there. But when it comes to fertility, we all know that the pregnancy rate will reduce if you're obese. So if your BMI is about 30, we start seeing a dip in your pregnancy rate. And if your BMI is above 40, we definitely will see a decrease in your pregnancy rate. So that is one thing. The second thing that obesity will do, it will also increase your miscarriage risk, right? So you'll be more predisposed. Even if you do conceive, you will be more predisposed, especially to first trimester losses, right? And the third thing, if you are in your IVF cycles, and we will also see a reduction in fertilization potential. So a reduction in fertilization rate will be seen if you're obese. So these are all the effects of obesity on fertility, right? Now, how about managing your PCOD and also if you have obesity, both? So when it comes to management, the first thing to remember is, if you have PCOD And along with it, if you're obese, obviously the first thing that we need to do is bring down your weight. So we have seen that even a modest 5% decrease in your weight will massively help your fertility. It will reduce your miscarriage rate, and it will also cause a good fertilization potential. So work on your weight for about at least 5 to 10%. And so reduction of weight stands on two pillars. One is good nutritious food, and second is exercise. So it is recommended that you do about 20 to 25 minutes minimum exercise daily if you have weight issues. So try and reduce your weight before you start on any treatment for your fertility. Once you reduce your weight, not only will your fertilization rate and your pregnancy rate go up, your miscarriage rate will go down. It will also have less long term effects on your baby. All right. So because your diabetes will go down once you have your weight under control, and the effects that diabetes have on your baby are huge. So that impact also you're potentially reducing if you work on your weight to start off with, right? So go to your doctor, start your fertility treatment, but make sure that you have your weight a little bit under control. At least 5 to 10% of weight loss is recommended before you start any treatment, and that rests on exercise as well as diet, right? If fertility is not the issue for you, if you do not want children, then OC pills will effectively counter your PCOD hormonal variation, right? So oral contraceptive pills will regularize your cycle and reduce the symptomatology of PCOS as well. If you are trying for fertility treatment, then the first line of action that we want to do with you is give you oral ovulagens or oral inducing agents, ovulation inducing agents. So we can start you off on either a follicular monitoring cycle or an IUI cycle, depending on the couple's evaluation. And we can use clomiphene citrate or letrozole for inducing your ovulation, right? So because chronic anovulation is one of the main problems that we face in PCOD, so to in order to overcome that and give your fertility a jump start, we can use oral induction agents, right? Along with that, we can also use adjuncts like metformin. um, so that will also help in your ovulation, right? So metformin is a important pillar of your PCOD treatment. The third thing is coming to IVF cycle. Now, in IVF cycles, we do see that in PCOD patients, to start off with, once we give FSH hormones, the response is a little less. But as the stimulation cycle goes on, we see a massive amount of response. So, what PCOD patients come under is the banner of hyper responders, right? So we have a lot of follicles that are growing. These follicles are giving a lot of estrogen, and what that predisposes you is OHSs, the complication of OHSs, that is ovarian hyperstimulation syndrome. And so we do manage it at our end. We try not to go for OHSs, of course, but it is one of the side effects of having PCOD baseline. So IVF can be applied in PCOD patients, and safely we can do your pickup as well. Coming to laparoscopic ovarian drilling, that is one of the modalities of PCOD, and what we are trying to do is reduce your AMH levels in laparoscopic ovarian drilling, and also reduce your testosterone levels as well. So that helps your follicles to eventually grow. What we usually do is we try to give oral inducing agents, and in case you have very resistant PCOD, in case even with that you're not ovulating, only then as a second line therapy we go for laparoscopic ovarian drilling. So that in total is about PCOD. A common myth is that if there is PCOD, all patients require fertility treatment, and that is not true. We see so many PCOD patients, even naturally conceiving, and even conceiving via simple follicular inductions, simple IUI cycles. So not every PCOD patients needs to go for IVF. Only if you have tried all the simple modalities, if you have tried natural conception, if you have tried oral ovulation inductions, IUI cycles are done, and then if you still have trouble conceiving, only then you are referred to for further IVF treatment. So that's it today for PCOD and obesity, and I would love to take further questions if any. how much weight is normal for PCOS? So there is no normal weight. Your ideally what we should go by is by your BMI charting, right? So we have underweight, we have normal weight category, we have overweight category, then we have obesity 1, 2, 3. So refer to your BMI chart. It's available on Google anywhere. You can calculate your BMI according with your weight and your height, and try and maintain your weight in the normal BMI category or maximally in the overweight category, and not going to the obese spectrum. So there's no normal weight as such. It depends on your height and weight combined both. Why does PCO make you overweight? So PCOD sort of triggers insulin resistance and glucose impairment happens. Also, there's another pathophysiology is hyperandrogenism. So it makes it difficult to lose weight. It may not directly contribute to your weight gain, but it does make it difficult to lose that weight. As I said, it's a vicious cycle. You being overweight might trigger your PCOD, and you being a PCOD patient might keep you overweight, right? So it is a correlation of that sorts. Is obesity common in PCOS? Yes. The answer to that is yes. Obesity is a common thing. Around 70% of obese patients will have PCOD, but not everybody who is obese will have PCOD. So this correlation I've already done in the lecture, that not every obese patient will have PCOD and not every PCOD patient is obese. But yes, we do find a good correlation. A big number of patients who have obesity do have PCOS. Is it possible to lose fat with PCOS? Yes, it is possible to lose fat, even though the weight loss may be a bit resistant because of the underlying metabolic issues that PCOD comes up with. So your metabolism may be slower than others, but still it is possible to lose weight. So a good combination of diet as well as exercise will make sure, and of course, even sleep forms a very important part of this. So there are different behavioral strategies that you can use while trying to lose weight in PCOD. You can keep a journal, you can keep a tab on your weight, you can also food journal, or you can log in whatever you're eating so that you have a good calorie intake calculation of sorts, and a good exercise routine. And you can also mix up that exercise routine. You don't need to do only one thing because it does get boring. So mix it up with a little bit of cardio, mix it up with a little of strength training. So muscle goes a long way to help you with PCOD, right? Good muscle to fat ratio is what is important when it comes to losing weight and keeping your strength and keeping your metabolism under control. So do work on endurance training. Also, you can include a little bit of asanas, a little bit of meditation, so that everything in together will help you lose that fat of in PCOS patients. How to cure with medicines? Okay, so unfortunately there is no cure for PCOD. You can just manage the symptoms of PCOD. There's no tablet or there's no injection in the market that directly cures you of your PCOD. So there are two ways to think about PCOD. One is, if you want your fertility, then you directly go to fertility treatments, and if not, then you can take OC pills and get your symptoms under control. For your irregular periods, OC pills will work wonderfully. For your hyperandrogenism, we have various tablet and preparations in market that reduces your hair. You also have a lot of cosmetic procedures in the market available. And your the problem with PCOD is basically that there are too many eggs and altered hormonal profile, and you can overcome it fertility wise with ovulation induction agents. So there's no cure for PCOD as such. And when it comes to your glucose metabolism, you can take myoinositols and metformin to keep your glucose intolerance in check. So that is another one thing that you can do. What meds can I take to lose weight with PCOS? So, medicine is only recommended if you are morbidly obese. So, your BMI is more than 40. Only and only then go for medicine, because it comes with a lot of side effects, a lot of nausea, indigestion, and stuff. Two things: one is medicine, and one is bariatric surgery. And both of them are only recommended if you are morbidly obese. Anything less than that, it can work only via exercise and diet. So no need to take meds unless and until prescribed by your doctor and you come in the morbidly obese category. Right. So that's it for today. Our centers of Oasis Fertility in Pune are in two places. One is at Wakad and one is at Kharadi. We'll be more than happy to take any more questions. You can call our fertility helpline given below directly or come for an appointment for your fertility. Thank you so much.